Welcome today to CHIME's webinar. We're going to be talking about recapturing demand and patient re-engagement post-COVID-19. And I wanted to introduce myself. I'm not usually out here with everyone, and I'm really pleased to be here today. My name is Amy Proffitt. I am the Director of Marketing and Media at CHIME, and I will be your host and moderator today with these two fine gentlemen. And I'll let them go ahead and introduce themselves. Vishnu, if you want to get started.
Sure, Amy, thank you so much for organizing this, and what a great honor and a pleasure to be here on this CHIME Media webinar. Hello, good afternoon, everyone. My name is Vishnu Saxena. I'm a Digital General Manager, Healthcare with the DXC technology. I'm based in New Jersey.
Thank you.
Hi, ladies and gentlemen. Thank you again. It's always a humbling experience to do an amazing event with CHIME. I mean, such an amazing organization. My name is Michael Archuleta. I am the Chief Information Officer for Mount San Rafael Hospital here in Colorado, and we're hoping for an excellent discussion today.
Thank you both, gentlemen. And before we get started, I just wanted to share a couple pieces of business. If you have any questions, you can submit them in the chat, and then we are recording, so this will be available afterwards as well. So with that, we'll go ahead and get started. My first question is for you, Vishnu. How has COVID-19 changed the healthcare landscape, and what does the current situation look like for you from your viewpoint?
Right, thank you, Amy. Of course, this is a very hot topic in our industry and the time that we live in. And it's a very uncharted world that we are on it right now. And as you know, and as everyone know, that COVID-19 hit us like a tsunami, right? Nobody was prepared for it. And the healthcare delivery has changed fundamentally forever. So that is A. And as let's see a little bit, how things have started. So in mid-March, as the cases have started to rise, and the first case was reported from Seattle and then started to pick up in March. So everybody, most of the health system in the US, they kind of put a the pause button, right, on the normal operations. All the elective procedures and everything was put on hold. And now as we restart, and as we restart the normal operation, it is very hard, to return to the previous level of clinical operations and business models. So what we see is, while the curve has flattened in most of the regions, but the crisis is far from over. And what in my discussion with many health leaders, and what the sentiments are, and what we are realizing is that the aftermath of the current crisis is far more challenging than the initial surge itself. And so, the reason for that is that, the post-COVID, the consumer and the patient base is now reshaped and resized. So we have a smaller market and the lower confidence. And so that is, in a kind of nutshell, what's happening. So there are a couple of points that I would like to make in terms of, where things are and how the healthcare landscape is looking like post-COVID. So one of the first thing is, of course, as we all know, there is a dual system of care now, right? So what does that mean? Of course, for the next 12 to 24 months, there will be a dual system of care where the health system and the providers will house both type of the patients, and they are expected to live and they're expected to deliver both dual, model of the care. So treating both COVID-19 and non-COVID-19 patients. So we all know that the COVID-19, types of patient comes up with their own set of challenges, right? Security measures, containment, protocols. So that will continue to be one of the key challenge to make the balance and how to make sure that, they win the confidence of the consumers that, everything's okay.
Right.
That is one. The second is, of course, the changed care delivery model. As we all know that, the care delivery model has evolved. And, there's a one phrase which is moving around in our world is that last decade of telehealth, virtual health, decade of telehealth and virtual health happened over last, I would say now 16 weeks, right? So the care delivery model has evolved. Virtual care has, now front and, front, left, right, everywhere. In the search, the health system used to have like, I would say in double digit, the virtual visits and all, but now it is happening in hundreds and thousands. So the changed care delivery model. Now, the third, which is, kind of like central to our point of discussion, and I will share more about it, is delaying care. So the consumer fear of COVID-19 exposure is causing patient, to delay or forgo of their care, or to seek care from different alternative sources. So that is again, the key, the point in terms of where things are. And the fourth is, of course, greater individual cost accountability. And, we all know that what the current economic situations are, right? So there is a major increase in unemployment and underemployment. So that is changing the private insurance coverage. And so there's a greater individual cost accountability, which is at the play. Now, of course, I mentioned reduced market size. The consumer, so there's a greater consumer fear, right? And the coupled with greater price sensitivity has reduced the overall market size, which is for the foreseeable future. Now, health systems have been running on thin margin, as we all know, and there are lots of M&A activities have been happening. So with this COVID, the health system economics have shifted. So the marginal cost of care in this dual environment of care will be high. So respective sources of margin have changed. Now the last one, which is very kind of like emotional, and which is very like kind of the core to with who we are as as a consumer, as a patient, and within the healthcare, is that our community is not healthy. We have a vulnerable community. So the communities that you, me, and Mike, and everyone lives in, the status and the health of that community that was in December or in January early this year is not the same as of today. So the communities all over the US is not as healthy as it was in January, and the health status of the community has worsened. So this is kind of a state of situation that I believe that we are living in. And the good thing is that of course things are trying to get back to the normal. There is a silver lining. There's always a light end of the tunnel, but it will take time.
It will take time. I thank you so much for offering those insightful points. I think you speak to many things that we'll talk about during this next hour together, but I think overall you just really hit the nail on the head when you said, the virus is one portion of what we're dealing with in all of our communities, but there are so many things that have come about in addition to that, and things that we just weren't prepared for in the healthcare industry. So all valid points, and I know that they're not unique to one healthcare system. There's a lot of challenges that we have to work through.
Right.
Why do you think that patient re-engagement is the most urgent and a key priority for health systems post-COVID?
Yeah, no, I think this is the central piece that everybody is struggling with. And the patient engagement was always a key topic, and like over the last 4 or 5 years, the patient engagement has taken a central focus. But in this post-COVID, I think the importance of patient re-engagement. So patient engagement has turned into patient re-engagement. And of course, health systems need to capture this demand. So I think this is a key issue that our industry is facing right now. And people are talking about, hey, where are the patients? Where do they go? Where are the patients? So and then how to drive the patient re-engagement. Now, and I see it from the both lenses, from the patient perspective and the health system perspective. So let me share very briefly about what the health systems are thinking. So one of the biggest concerns that the healthcare stakeholders now they have is to how to reach to the pre-COVID level of patient activity and the revenue. So that is something that they are thinking, right? Because overall, the patient market size is now small and reimbursement is lower. And so that is, and then of course, the patients are not coming and the ED volumes are down. So that is something that the health systems are thinking. And of course, the competition was already there, and the competition to serve these patients are even intense.
Right.
So essentially, it is very important that to look at from the patient's perspective also what is causing them not to re-engage and why there is a significant drop in the healthcare engagement. So I would say that New England Journal of Medicine, the Catalyst, they came up with a very interesting survey that indicated that the emergency room visit, the ED visit, is down 50%. Now, let me switch to the patient point of view, which is very important. And because as I posted in my LinkedIn post, because the health and the financial risk is very high for them. So that is the two key factor where the engagement is dropping. And in fact, the patient who have left the health system are hesitant to return, and they are avoiding the critical care, and so their point is very valid. And I want to touch upon two research survey which just came in like last I think 2 to 3 weeks. One is from PwC. So PwC is called Health Research Institute. They did a recent survey, and they found out that, and I quote, 32% of consumers have already made or planning to make adjustment to spending on healthcare visits as a result of COVID.
Wow.
And 78% consumers in that survey said that they would skip at least one visit where no matter if it was a wellness visit or a maintenance visit or a chronic illness or an elective procedure, and or a recommended lab testing. So that is something is a very eye-opening. And there was another survey which was done by TransUnion, and they found out that patients who have deferred an elective procedure, nearly 50% indicated that they will only reschedule once they no longer believe that there is a high risk of COVID-19 infection or guidance, and it is safe now. So the patients are considering the health system as a reservoir of virus now. So that is something the patient point of view is extremely valid, that they need assurance. They need a confidence that it is safe to go to the facility. And we'll talk about as a part of our strategy discussion in terms of how to recapture demand. But these are some of the fundamental causes that it's essential that we got to re-engage patient, because it is causing the health systems, but essentially it is causing the health of health system as well as the patients, as we get back to the path of recovery.
And I'm sure you and Michael will touch on this, but I think there's a lot of just noise out there from the patient's perspective. They are consuming information from all these different avenues. And so on the healthcare side of things, we have to be able to work through that and, like you said, regain their confidence and have them see that in that light and kind of put away all that noise that all these messages are coming in. We need to work through that to make sure they know they can come to these healthcare systems for care. So thank you, Vishnu, for that. Michael, let's switch to you. What does this mean for high-risk populations?
Yeah, absolutely, Amy. So thank you very much. So again, as Vishnu stated, the new normal is not clear yet, but we need to really start moving towards it. And that's such a critical element. And I kind of want to fast forward a little too, is I had a discussion on COVID-19 may have just saved the US healthcare industry. And why do we basically say that? Because as Vishnu is basically stating, is there's pros and cons to this. This has been a horrible pandemic. No one should have lost their lives with this. And I feel so saddened for all the family members that had lost a loved one during this overall pandemic itself. But looking at the healthcare industry as a whole, did COVID-19 basically save the US healthcare industry? Healthcare has been one of those organizations that has been behind many years when it comes to technology advancements. I mean, you look at the natural gas industry, you look at the banking industry, we are 2 years behind the specific curve. But we are doing the most important aspect out there, and that's saving people's lives. That is improving lives. That is utilizing, technology and initiatives, these amazing physicians to improve these outcomes. but we're behind the curve when it comes to advancements of the utilization of technology. We should be, as an industry, leading this overall pack moving forward. We should definitely be creating these asynchronous tools that benefit the patients both inside and outside of our organization. Right now, our actual patients, our community, you know, they have to have true trust in our organization. Knowing exactly what we're doing, what we're providing as a whole is such a critical point. And I always like saying that the acceleration of digital transformation is truly here. And as we've been stating, you know, the mass adoption of telecommunicating has been one of the most explosive changes to truly occur during the overall coronavirus pandemic. And when we look at, you know, high risk populations, incorporating IT as a core component to the organizational strategies allows organizations to successfully utilize in-home care tools and devices to really help patients, you know, with their prescriptions, with health monitoring, because keeping our elderly and those with chronic conditions healthy during this unprotected, you know, health crisis is extremely critical. And again, you know, the utilization of in-home patient engagement tools allows providers to really have better opportunities to, you know, both better understand how patients are taking their meds, how they're, you know, how we're supporting our patients with answers to their health, and have the opportunity to answer their questions via the comfort of their home. And they're keeping at that social distancing. So again, as a healthcare organization focusing on a high-risk population, we need to continue to basically build those asynchronous tools that are benefiting those patients both inside and outside of our organization. That's a critical element. And then when we look at the COVID-19 response bill, which basically will allow Medicare reimbursements for care providers using telehealth to treat seniors at home, is truly a critical first step. But again, we definitely need to do more to enable our healthcare professionals to provide patients with the best care and in a timely manner, especially for all populations moving forward. So really having that true engagement, technology initiative in place has been important. And I always say too that this crisis has fully displayed the value of IT and digital transformation. And that is a critical element. And if we as an organization, again, do not continue to focus on our patients' needs, what is needed, how do we gain trust? How do we gain loyalty from our people? That is continuing to focus on initiatives that improve outcomes for themselves. And that's basically the bottom line.
I love what you have to say, Michael, about that. I think too, you know, the value of IT is so incredibly important. It allows us to meet patients where they're at. You know, these, instead of forcing patients to come out of their homes to get care, really meeting them, the high-risk patients where they're at by using the tools that we have, or continuing to find technology solutions to keep them safe, if that means, you know, them being in their own homes and getting the care that they need. It's incredibly valuable. And we always talk about how things have just happened at the speed of light, like we've never seen before in healthcare. And I think telehealth is that #1 tool that can really help reach patients and let them stay engaged and access the care that they need. And it's incredibly valuable at this time more than ever. So Vishnu, I want to switch back to you for a second. Thank you, Michael, for that. How can health systems recapture demand in the dual systems of care, COVID and non-COVID?
Yeah, no, I think this is very important. And what Mike just mentioned, you know, there's again a very interesting phrase moving around these days on the LinkedIn and Twitter that who drove the digital transformation? To answer, CIO, no, COVID did. So, you know, of course, as you can see in all walks of life, not necessarily in healthcare. So, you know, to your question, of course, how to recapture demand in this dual system of care is significantly important. And health system leaders are essentially focusing on varieties of strategies to re-engage patients and recapture demand. And there are a couple of strategies which are proven, and you know, actions that providers leaders are actually taking. And I wanted to articulate and I wanted to highlight one which was recently published, again in New England Journal of Medicine, Catalyst recently. And that is the proven model of, how you can recapture demand. And, and the strategies are very simple. We all know that, and it is very close to our heart. And we have been living this, all through, since the healthcare transformation started to happen. And that is very well known, and you can guess it right. It is human-centered design. So what is happening is application of human-centered design principles is, in terms of recapturing demand, is extremely critical. And there are very encouraging success stories, as I mentioned, and I wanted to highlight this. So there is a 150-bed community hospital in California, right, that partnered with human-centered designers to quickly address the sudden drop in emergency department visits. And when the statewide stay-at-home order was announced in California, so that was the first state. Like California, as we know, was the first state. And initially, when the volume of the patient started to go down to this hospital, they liked it because, I think they really wanted the patient not to come, the critical patients and all, because they wanted to prepare for the surge. And but with the time, with the decrease in the emergency, with the ED visits, the volume went down, and then alarming statistics started to come. So then they realized what to do. So some of the data which I wanted to highlight that is that, so the high acuity patients, they expected to need medical care. They're not coming to the hospital. And the second, the EMS reported the highest ever number in cardiac arrest in the field, and 45% more than from their previous month. So it was like in March and April. So that is something I'm just trying to share with you some of the data insight which came out of it. And so long story short, they quickly assembled a multidisciplinary group of people, including physicians, medical students, experience in human-centered design, user experience and all, and product management and all, and they conducted phone interviews. They conducted phone interviews with the patient and with the providers to really understand what's going on, what's the problem, and regarding the hospital usage and what they can do to build the confidence. So essentially, the sample, so those interview, resulted into some sampling. So that was used to identify, their healthcare, their experiences, socioeconomic status, and then it was converted into to identify themes, synthesize insights, brainstorming, and prototype. So what happened is, so they came up with like a couple of themes. So I wanted to share, the theme one, which is more about kind of profiling the consumer base. And then, the theme one was like hospitals, as I mentioned to you, that hospitals were seen by that patient community as a infection reservoir. And patients reported that, they wanted to avoid hospital because it carried a greater risk of exposure to them. So that was one. The theme two was that patients were not informed about the current risk mitigation effort by the hospital. And one of the patient, in fact, in the phone interview said that if you provide me a message that come here and you will be given the mask, that is not sufficient. So that was one, the patient said. Another patient in that phone interview said that a lady said that she wants to smell the scent of bleach when she comes to the hospital, and she wanted to communicate that the hospital should careful about the cleaning protocol, right? And the patient community wanted to be assured that community hospitals is careful and implementing that cleaning protocols. So these are the patient's concern, and one patient responded in that phone interview that he said that he would feel more reassured if he received an email from that hospital that describe the cleaning practices similar to what he receives from the airlines. That no, there's nothing to worry. We are doing this cleaning. We have, sanitizing this quite often. Those kind of things. So the point is that based on this human-centered design principle, this multidisciplinary team reached out to the patient community and the providers to identify the key concern, and they resulted they identified into the themes. And so the theme third was that patient need confirmation from their doctor, because patient and hospital, they have a relationship, and the patient wanted that they want to get the communication from the provider, from the hospital itself, about when to go to ED, and the patient have, of course, so that is the kind of the trust and the confidence will boost. So these are some of the themes which they have come up with. So there's one more, responded, and I'm, trying to share that, that they would like or received an email or text from the hospital stating that even if you don't have the virus, please don't hesitate to come. Even if you are you're healthy, please come to our hospital. So these are the kind of outreach communication which is essentially needed. And of course, that goes to the profiling the consumer base. So what's happening is, in most of the, sorry about that, in most of the market, the providers are expected to see a distribution of consumers, right? And where despite a small defined number of high need patients, and then there are a greater majority, and then which are hesitant to return to the care delivery setting, right? And then there's another set of the patient community which is very hesitant to return, and some of them have exited from the healthcare system altogether. I'm not coming back, just like that. So the providers have to profile, they have to size, and they have to segment their market by clinical services, and to understand the value, to recapture the potential of their patient community and what exactly they are looking at. So that is one. So human-centered design, the chief marketing officers, we have the CMOs and all, and I think, and they're already actually thinking about in this direction in order to, come up with a very targeted, personalized communication, from all across multi-channel, whether it is Twitter, whether it is like email, and, so the provider-led communication and the profiling is, one of the way to recapture demand. And then the second is, I would say, reactivate and accelerate high acuity, high need patient base. And that means is, the providers have to aggressively reactivate outreach to these patients with the clinical profile, which requires, immediate care, right? So that is the another strategy that, the health systems are taking these days. The third one is you have to gain the community confidence. And like the way this hospital did in California. So you have to engage consumers, you have to regain community confidence, and that's how the patient will start getting to know what measures hospital have taken for the dual system of care. I really like that quote when the lady said, I want to smell the bleach. I want to make sure that you're cleaning that, you're sanitizing properly. Anyway, so the clinical leadership is going to employ a targeted and personalized direct to consumer campaigns. So the chief marketing officers have even more tasks now, and I think it's a greater opportunity to build that confidence, build that gap which has caused by this COVID-19 thing. And communicate that how their care will be delivered in the future, and what measures they have already taken, and how the new processes is being implemented in a discrete care environment for COVID-19 and non-COVID patients.
I really appreciate the research that you shared during our time together. And I think I come personally from a hospital background and patient care. And so I think the most important thing is always focusing on the patient first. And we cannot understand their pain points and their fears if we do not ask the right questions. Right. So really, the human-centered design and putting those questions out. We can guess, but until we ask the right questions, we can't address their needs properly and give them the proper care. And I think when it comes to something as scary as a pandemic, and breaking through all the noise, like I was talking about earlier, patients are just hearing things from all over the place, social media and the newspaper and the news and things like that. You cannot be transparent enough, and you cannot over communicate. You just can't do it. And I think they need to be reassured, and they need to have that communication from the health system, from their providers, all of those things. I just don't think that you can do that enough. So I think you really shared some great points with that. Thank you for that. Michael, I want to ask you, how do you think digital health in your organization will look post-COVID-19?
Yeah, absolutely. Thank you, Amy. I want to share some top technology concerns for organizations real quick. So this is all based on percentages. So basically 32% of organizations, some of their concerns are high demand for collaborative tools, guides, training, and operating norms. Again, increase the strain of the company's financials, the increase of cybersecurity threats, the increased strain of infrastructure, the immediate boost in online traffic, new tech-enabled business models, and truly reinvesting in critical areas, which again, I always state that the acceleration of digital transformation is here. And as I basically stated, the mass adoption of telecommunicating has been one of the most explosive changes to truly occur during this overall COVID-19 pandemic. And after the COVID-19 outbreak, telemedicine will be more active than before. I mean, the COVID-19 crisis marks a before and after in telemedicine. And as I stated, the acceleration of digital transformation is here. And again, we have seen the value of telemedicine for our saving time and money. But as a CIO, before we start investing more, we truly need to maximize the return of investments we have already made, and truly work with our leaders, to hold the gains from virtual visits, to determine the initiatives, the pros and cons. How are we basically utilizing telemedicine? Because again, telemedicine has been one of those elements that has really come in. Telecommunicating applications, sending people home, communicating via virtual applications, having that visit available for high-risk patients, just being at home, staying that social distancing. So again, telemedicine has been one of those critical elements. And then looking at personal health records, the more telemedicine is active, the more chronic patients will manage their health through personal health records. Patient-generated health data from chronically ill patients will be incorporated into the electronic medical records more electronically than before. And truly, we're going to see doctors, in remote hospitals prescribing more medications for their patients through telemedicine. And again, IT readiness, really looking at the initiatives that had truly happened during COVID-19, and how this crisis has fully displayed the value of IT. And, regardless of the size of your organization, IT readiness is such an essential for any group moving forward to survive. We're starting to see a lot of these healthcare organizations, even really, once COVID came in, it was like a massive push to digital transform your organization, to send people home. How are we sending individuals home? How are we successfully keeping cybersecurity initiatives as top priority? These are strong issues that we basically need to deal with. And there's a quote that always goes is, you have to keep your home in order. And I always basically state that is, if organizations, just like building the home, we basically build a very strong foundation moving forward. And if we decide to maybe be a little cheap on the foundation, utilize a different type of initiative, again, a different type of technology here and there, eventually it's going to crack. So we're starting to see this on an IT readiness. A lot of the organizations weren't truly ready to digital transform, to send people home. How is your home? Is your home truly in order moving forward? And then looking at interoperability initiatives, that has been such a critical element too, is how are we sharing information successfully, efficiently with one another? And I think that's such a clear opportunity for improvements moving forward, from the exchange of non-standard clinical data and non-clinical data, such as data on ventilators, capacity, different initiatives on how are we continuing to create better initiatives for the continuity of care with the utilization of interoperability. Interoperability has been one of those loose keywords that has been around for a while. We truly need to move forward and basically improve those initiatives. And then looking at cybersecurity, that is such an item I'm very, very passionate about, because at times we do not focus strongly on those initiatives. And again, we see how the HHS has been hacked, how a lot of initiatives have basically, how a lot of organizations have been hacked due to this overall COVID-19 pandemic. It is a shame, it is an issue. But we truly, cybersecurity is no longer just about data security. It's also a matter of life and death. And again, the sudden COVID-19 related surge in the use of video conferencing, remote access, and VPN services, especially in healthcare organizations that had not used them before, is truly giving attackers more targets to go after. And what I basically like to call the attacks of opportunity, which is such a shameful thing. But these individuals are utilizing COVID as an attack of an opportunity to gain access into systems. And many healthcare organizations, did not, again, have the infrastructure for this sort of, work, and had to really deploy it quickly. So moving forward, post-COVID-19, healthcare organizations are now more than ever intensifying their focus on strategically planning for a digital future, with top focus on cybersecurity, and preparing themselves to be ready to launch new initiatives when this crisis passes. Because I truly believe that this unpredicted pandemic puts us in a position to be more progressive and open to learning from it. If we can truly take the experience gained from COVID, from this actual unique challenge, we can evolve our practices. And that's such a critical element, because again, healthcare has been one of those organizations that has been truly behind the curves when it comes to technology advancements. Like telecommunicating, cybersecurity, everything coming into place to truly create a better experience is top of mind. And as you stated too, Amy, patient care is number one. That is the number one reason we're here. If you work in healthcare, if you work in a clinic, you work in a hospital, your number one initiative is patient care. That is the number one thing to basically focus on. And again, when we talk about the consumerism of healthcare and how individuals are really taking more initiatives, more focus on their cares, they have more opportunities. And we're starting to see the millennial population really come into place. They want specific items on demand, here and there. And as an organization, as I state, if we do not continue to build these asynchronous tools that benefit our patients both inside and outside of our organizations, we have failed our patients, bottom line. And again, this overall COVID-19 pandemic has been horrible, but it could have perhaps saved our overall industry, especially with the acceleration of digital transformation.
Thank you for that, Michael. I think, when you talk about actions and strategies that CIOs can take, you really nailed it when we're talking about interoperability and just IT readiness. It's just not one of the ways in which you want to save money. It's such an important part of the structure of a healthcare system to keep our patients safe. And now more than ever, like you said, cybersecurity is a life and death issue. And I think this is one of the ways, like you said, that COVID really sort of saved our industry. It shows how important things like cybersecurity and IT readiness are just vital. They're absolutely vital to the health and care of our patients. So you hit the nail on the head with that. I wanna thank you both. We're not done yet. We do have a question that I'll share to both of you, and you can both respond from our audience here. I'll take a moment to read it. This is from Jason. With the move to broad telehealth, traditional face-to-face triage methods, vital signs, finger sticks, etc., are not available. What kind of processes, tools, and data is being used to overcome the additional risks that may be without face-to-face triage? So do either of you want to take that one?
CIU, you go first.
Absolutely. So in regards to that, in taking any initiative, so again, we are learning from this overall pandemic. Again, I believe that this unforeseen pandemic really puts us in a position to be more progressive and open to learning from it. And as I stated, we can truly take the experience gained from this unique challenge to really evolve our practice and continue to really invest in digital transformation. But again, there is pros and cons to telemedicine, and that's such a critical element. And as I stated, in one of my statements in regards to telemedicine is, we have to work with our leaders to really make sure that that the gains from virtual visits are really beneficial to our organization. How are we utilizing telemedicine as a whole? Have we seen benefits? Have we basically, before we start investing, are we really looking at maximizing the true return of investments that we've already made, especially with this mass adoption of digital transformation, telecommunicating applications? So again, there is pros and cons in regards to it. I think we're all learning from the different initiatives to create better outcomes. But I think telemedicine, telecommunicating is truly one of the futures moving forward.
Right. And I agree with, 100% what Mike has said. Given the current environment that we are in, telemedicine is the medicine, and no doubt about it. And, we used to struggle, we used to call it's a future of medicine, and, no, it's here, it's staying, it's normal, it's done deal. But at the same time, there's a truth to it, that something that cannot replace, like in face-to-face setting, when it comes to complex and critical conditions. So telemedicine goes up to a certain level, but certainly when you have, a condition which is critical, that requires, let's say, you have a neck or back condition, so that requires physicians to essentially review your MRIs or your condition. And I think so most of the platforms are not supporting as of now, and the telemedicine is mostly for the normal sick visits and all those kind of symptoms and rashes and cold and cough, those kind of things. Things are maturing in a direction where telemedicine can support the critical conditions. But yes, it will take time, and at the same time, in like face-to-face setting is something which the patients are hesitant to go. So it's very difficult to kind of like answer. But in this present environment, if it was not, it was very easy to say. But so the maturity of the telemedicine will continue to go up, and there's now the virtual waiting room type of apps are coming, because if I'm a physician, I have like 200 patients to see, like 1 day or 2 day, but at the same time, I'm not able to provide a greater digital, patient experience to them. So there are lots of things coming. Telemedicine is also kind of maturing, and and one of the key, what I call it, gap used to be, the telemedicine used to be very episodic. So for example, I'm a patient, Mike is a physician, Mike did my consultation, it's done. There's nothing kind of like post this virtual visit follow-up. But in this case now, I think, those broken links are getting together so that there's a continuation of care and the follow-up and communication to make sure that, the patient who's consulted is engaged.
And that's a critical point right there too, Vishnu, is how are we re-engaging with patients and truly bringing, our overall community to have confidence in our organizations.
You're right.
And that was definitely one of the actual questions to ask. And I want to kind of bring this up in regards to this, because this incorporates into telehealth, telemedicine, etc. Is we as an organization need to continue to truly focus on those patient engagement strategies, which I think is extremely critical. And if a lot of you know who I am, I always basically state that I have a new CEO, and my new CEO is the discussing penalty. We will have to earn their trust by truly knowing them,
Right.
and providing them with the tools that meet their actual needs. And again, COVID-19 has shed light on healthcare needs for digital tools and the importance of a here and now with timelines, which have been extremely critical. And if you're truly a transformational CIO, you know that hospitals and clinics are digital companies that happen to deliver healthcare services. Again, we are living in the digital age of healthcare, and we again need to continue to build those asynchronous tools that benefit our patients both inside and outside of our organizations. And the mass adoption of telecommunicating has been one of those massive changes to truly occur during this overall COVID-19 pandemic.
Michael, I'll just restate. It cut out for me a little bit, but I've talked with you enough to know I think I know what you were saying before, was that your new CEO is the patient. Is that correct?
That is correct, Amy. My new CEO is the patient, and that's basically the bottom line. And again, just to talk about that again, is if we as an organization want to continue, to gain their loyalty, we have to earn their trust by truly knowing them. As you stated, knowing them. That's a critical point, ladies and gentlemen, knowing who they are. So we could basically design and provide the tools that meet their needs, which again is such an important aspect. So my overall focus on anything that you see on a bio, anything, LinkedIn, Twitter, my number one statement is patient care is number one. And that definitely needs to be our overall initiative. If you work in a hospital, clinic, any healthcare organization, patient care is number one. How are we continuing to basically utilize technology to improve better outcomes? And that's an important factor in order to create success.
Yeah, completely agree. That's very much on spot, Mike.
Absolutely. I want to just sort of end our time together here just by giving our audience any time to chime in with any other questions. And then Vishnu and Mike, if there's any other thoughts that you want to share at this point, just to summarize our time together today, I would invite you to do so.
Absolutely, Amy. I like to leave off with this, is that the COVID-19 crisis has fully displayed the value of IT and digital transformation. And out of every crisis, a new opportunity arises. The IT team has been through a lot, and they truly need your support and leadership, because as a true leader, our first focus should be taking care of our people. When we focus on people, process, then technology, and incorporate IT as a core component to the organizational strategy, we will be in a much better place. And there's a Spanish word that I like to include, which is adelante. What does adelante mean? Adelante means forward. Let's move adelante and together to truly transform our industry. Because yo creo en nosotros, which means I believe in us, and I truly believe in this industry and the people that basically work in it. So thank you guys very much. Always humbled to be here.
Yeah, thank you, Mike. And my closing comment would be, Amy and Mike, is that there are many things that we used to take for granted, a couple of months ago, and those things are now at the rescue. It took it's a kind of this crisis to bring those kind of things to at the front and center. And I'm sure as we come out of it on the other side, we will be very strong. And of course, there are lots of things happening in terms of vaccine development and the medicine development. So we will get through this phase, this crisis, this chapter. At the same time, when the new chapter, when the dawn comes, and I think we will find ourselves stronger within the healthcare.
I agree with you too. So thank you both so much for sharing your thoughts, your passions about things, your insight. Vishnu, all the research that you've shared today is really insightful. And, you know, the discussion continues.
Absolutely.
Together today. There's news and developments happening daily. And so I want to thank you both for your time today. And I want to thank our audience for joining us today. Again, we're going to have this recorded and available afterwards, but it's such an important topic and such an important time for us to come together as humans to discuss how we can move forward. And I won't even try and pronounce that like Michael did, but we can move forward together, and we will do so. So thank you, gentlemen, and thank you for those who have joined us today. And we just want you to take care and continue to be safe and healthy.
Absolutely. Take care, Amy.
Thank you guys very much.
Bye-bye.
Take care.